September is Childhood Cancer Awareness Month, and now Mercy Hospital Kids needs your help for their youngest patients. News 4's Paige Halsey shows us how blood donors can have such a big impact on pediatric cancer patients.
It just doesn't seem fair that the most innocent among us sometimes face the hardest battles, like Braden, who's fighting acute B-cell lymphoblastic leukemia.
One of the things that's unique about childhood cancers compared to the types of cancers that we see commonly in adult patients is that they are usually very rapidly growing and very aggressive. And the best therapies are therefore very aggressive chemotherapy regimens.
But that can be hard on tissues and organs, wiping out a lot of normal bone marrow where blood cells are made.
And then during that time, their blood counts go very low and they become dependent on blood transfusions.
Without it,
You have less energy, less endurance, sleep more, you are less fast in your thinking. I mean, everything just kind of slows down. And so when you get a blood transfusion and you suddenly go from a very low number to now a normal number, there can be a dramatic change in the child who now is just as energetic and active and playful as they would be if they weren't getting chemotherapy at all.
Are we talking minutes after they get it?
I mean, literally, yes. So often the patients, later that day, like, wow, I got my kid back.
but to make that possible, the hospital needs blood donors, often.
When someone donates red blood cells, they're only good for 4 weeks. When someone donates platelets, they're only good for 5 days.
That's why this week, Mercy is hosting a blood drive. Appointments are required to ensure social distancing. Mercy pediatric oncologists tell us the blood donated at this week's drive will stay here and help patients right here in St. Louis. For News 4, I'm Paige Halsey.